Hey there, it's Dr. J, and I need to talk to you about something that I think almost nobody is talking about, and yet it's probably affecting your health right now. Walking. Yeah, I know that sounds simple. Walking is one of the most basic human activities. We've all been doing it since we were little kids. But here's the thing that I've discovered after 20 years of clinical practice and studying movement science and biomechanics. Most people over 50 are walking wrong, and I'm not just talking about a little bit wrong. I'm talking about walking in ways that are literally destroying their knees, their hips, their lower back, and their overall health and longevity. And the worst part? Most people have no idea they're doing it. They think walking is this simple, harmless activity that couldn't possibly be causing any damage. But it is. And in this video, I'm going to walk you through 7 specific walking mistakes that I see every single day in my clinic, and these mistakes are probably destroying your health right now. And before we get into the mistakes themselves, I want you to understand why this matters so much. Walking is something that the vast majority of people over 50 do every single day. It's often the primary form of exercise that older adults are doing. And if you're doing something incorrectly every single day, that incorrect movement pattern gets reinforced and embedded in your body over and over again. And over the course of weeks and months and years, those incorrect movement patterns lead to injury, lead to pain, lead to dysfunction, and ultimately lead to loss of mobility and independence. The opposite is also true. If you're walking correctly, if you're using proper form and technique, then every single day you're reinforcing good movement patterns that support your health, protect your joints, and help you maintain the mobility and independence that you need to live a full life. So let's dive in. I'm going to explain each of these 7 mistakes, why they're problematic, and what you should be doing instead. And stick with me all the way to the end because I'm going to give you some practical advice about how to correct these mistakes and start walking in a way that supports your health rather than destroying it. The first mistake that people over 50 are making when they walk is not engaging their core properly. Now, when I say core, a lot of people think about their abdominal muscles, and they think about doing crunches or sit-ups, but that's not what I mean at all. When I talk about the core, I'm talking about all of the muscles that stabilize your spine and your pelvis. This includes your abdominal muscles, but it also includes your back muscles, your hip muscles, and your diaphragm. The core is basically the muscular system that keeps your trunk stable and upright when you're moving. Here's what happens when most people walk, especially as they get older. They kind of shuffle along, and their trunk is unstable. Their spine is wobbling a little bit, their pelvis is unstable, and their core muscles are not engaged and working hard. When you walk with a disengaged core, a whole bunch of bad things happen. First, your joints have to work harder to stabilize you, particularly your knees and your hips. Your knees and hips are designed to create movement, not to provide stability. But when your core isn't doing its job, your knees and hips have to do the stabilizing work, and that's not what they're designed to do. Over time, this leads to knee pain, hip pain, and joint wear and tear. Second, when your core is disengaged, you shift into a posture that's not ideal. You tend to lean forward a little bit, which puts extra stress on your lower back. This is one of the major contributors to lower back pain in older adults. The fix for this is simple, but it takes some practice. When you're walking, I want you to think about drawing your navel in toward your spine. Not to the point where you're holding your breath or you're being too rigid, but just gently. You want to create a mild contraction in your core muscles. You want to imagine that you're pulling your lower belly in and up slightly. When you do this, you'll immediately notice that your posture improves, your spine feels more stable, and your movement feels more controlled. This is the kind of core engagement you need to maintain throughout your walk. It should feel like you're standing a little bit taller and a little bit stronger. If you practice this every time you walk, it becomes automatic after a few weeks, and you won't have to think about it anymore. The second major mistake that people over 50 make is taking steps that are too short. I see this all the time. People come into my clinic, and they're shuffling along, taking these tiny little steps. And they justify it by saying, well, I'm being careful, I don't want to fall. But actually, taking steps that are too short is making them less stable and more likely to fall, not more likely to avoid a fall. Here's why. When you take long, purposeful strides, your hip flexors, your glutes, your hamstrings, and your calves are all working hard. These muscle groups are important for balance and stability. When you take short, shuffling steps, these muscles aren't working as much, and over time, they become weaker. Weaker leg muscles mean worse balance, which means higher fall risk. So by trying to be cautious and taking short steps, people are actually making themselves more vulnerable to falls. Additionally, when you take short, shuffling steps, your gait becomes less efficient. Your muscles have to work harder to cover the same distance. This actually causes more fatigue, not less. And if you're fatigued, that's when your movement quality really starts to break down, and that's when injuries happen. The other problem with short steps is that you're not getting as much hip extension. Hip extension is the movement of your leg going backward. When you walk with longer strides, your hip extends further, and this helps mobilize your hip joint and keep it healthy. When you walk with short strides, your hips aren't extending as much, so you're losing hip mobility. And over time, this can contribute to hip tightness and hip problems. The fix is to consciously take longer, more purposeful strides. I'm not saying you should speed up your walking. I'm just saying you should lengthen your stride. Think about pushing off from the ground with your back leg and reaching forward with your front leg. When you do this, your whole leg from your hip to your toes is going through more of its range of motion, and this is better for your joints and better for your muscles. The third mistake is not paying attention to your foot strike. This is a huge one, and most people have no idea how much their foot strike matters. When you walk, your foot hits the ground in a specific way, and that foot strike creates a chain reaction of forces that travels through your entire body. If your foot strike is wrong, it sets off a domino effect of problems that cascade through your ankle, your knee, your hip, and your lower back. The most common foot strike mistake I see is people landing on their heel with a straight leg and kind of braking as they land. This is called a pronounced heel strike, and it's terrible for your joints. When you land hard on your heel with your leg relatively straight, you create a shock wave that travels up through your leg. This shock wave puts stress on your knee, especially if there's any misalignment happening at your knee. And over time, this contributes to knee pain and knee problems. The ideal foot strike is much gentler. You want to land on your heel, but with your knee slightly bent. As your foot contacts the ground, your knee bends a bit more, which acts like a shock absorber. This reduces the impact forces that travel through your body. And instead of braking, you want to be rolling your weight from the outside of your foot forward to the inside, and then pushing off from your toes. This creates a smooth, flowing movement rather than a jarring, braking movement. Additionally, I see a lot of people landing on the midfoot or even the ball of their foot when they walk. Some people think this is better, like they're doing some kind of fancy running technique. But for walking, especially for older adults, a gentle heel strike with a slightly bent knee is actually the most efficient and the safest. The fix is to pay attention to how your foot is hitting the ground. Start paying conscious attention to your foot strike when you walk. Land gently on your heel, let your knee bend slightly as you land, and then roll your weight forward and push off from your toes. It feels a bit awkward at first, but after you practice it for a few walks, it becomes natural. The fourth mistake is not maintaining proper posture while you walk. Now, I talked a little bit about this when I talked about core engagement, but posture deserves its own discussion because it's so critical. The way you hold your body when you walk has a huge impact on your health and your joints. The most common postural mistake I see is people walking with their head forward and their chest closed. You know the posture I'm talking about. It's like people are being pulled forward by their head. They're looking down, their shoulders are rounded forward, their chest is caved in, and their lower back is strained. This is sometimes called upper cross syndrome, and it's incredibly common in modern society because of all the time we spend sitting and looking at phones and computers. But when you carry this posture into your walking, it creates all kinds of problems. First, when your head is forward, it changes how your body balances. Your head weighs about 10 to 12 pounds. When it's positioned forward, it puts your entire center of gravity out of alignment, and this makes you work harder to stay balanced. Second, when your chest is closed and rounded, your lungs have less room to expand, so you can't breathe as deeply. This means less oxygen getting to your muscles and your brain. Third, this posture puts excessive stress on your neck and your upper back because your muscles have to work extra hard to support the weight of your head. The fix is to walk with what I call proud posture. I want you to imagine that you're walking with a crown on your head and you're trying to balance the crown by looking straight ahead and walking with your head up. Your shoulders should be relaxed and back, not shrugged up toward your ears. Your chest should be open. Your spine should be relatively straight. And your eyes should be looking forward and slightly down so that you can see where you're going without having to crane your neck. When you adopt this posture, you'll immediately feel stronger and more stable, and you'll notice that breathing becomes easier. The fifth mistake is not moving your arms properly when you walk. A lot of people walk with their arms just kind of hanging there, or they don't swing their arms at all. But actually, arm swing is really important for several reasons. First, when you swing your arms while you walk, it helps counterbalance the rotation of your lower body. Your legs are rotating one way and your arms are swinging the opposite way. This creates a balanced, symmetrical movement pattern. When you don't swing your arms, this natural counterbalance is lost and you lose stability. Second, swinging your arms while you walk actually helps propel you forward. It's more efficient. You don't have to think about it, but when you're swinging your arms, they're doing some of the work to move your body forward, so your legs don't have to work as hard. Third, swinging your arms engages your core muscles more than just standing there with your arms still. The rotation that comes from arm swing requires your core to work harder to stabilize you. The other mistake people make with their arms is swinging them too much or too little. Some people barely move their arms. Other people swing their arms way too much, flailing around like a windmill. The proper arm swing should be relaxed and natural. Your arms should swing from your shoulders, not from your elbows. Your elbows should be bent at roughly a 90-degree angle. When you swing your arms forward, they should come up to about waist height or slightly higher. When you swing them back, they should go back naturally without straining. The whole arm swing should look and feel relaxed and natural, not forced or exaggerated. The fix is to pay conscious attention to your arm swing when you walk. Let your arms swing naturally from your shoulders. Don't force it, don't exaggerate it, just let them swing at whatever feels natural. After a few walks, you'll develop a rhythm that feels good and is biomechanically efficient. The sixth mistake is not paying attention to your pace and variety. A lot of people fall into the trap of walking at the same pace every single time they walk. They go out for their walk at the same speed, the same distance, the same route, and they do it day after day. While consistency is good, doing the exact same thing every single time without any variation is actually problematic for your body. Here's why. When you walk at the same pace every single time, your body adapts to that stimulus. The muscles that are being used at that pace get conditioned to that pace, but they're not getting challenged to adapt and improve. You reach what we call a fitness plateau. Your body has adapted to the demand, and there's no more stimulus for improvement. Additionally, when you walk at exactly the same pace all the time, the forces going through your joints are the same all the time. This can lead to overuse injuries because the same structures are being stressed in the same way repetitively. The fix is to incorporate variety into your walks. Some days walk at a slower, easier pace that you could sustain for a long distance. Other days walk at a brisk pace where you're breathing a bit harder. Some days do shorter walks. Some days do longer walks. If possible, vary the terrain. Walk on flat ground some days, but on other days, if it's safe, try walking on slightly uneven terrain or hills. This variety keeps your body challenged and helps you continue to improve your strength, endurance, and balance. The seventh and final mistake is not paying attention to your shoes. This might seem like a small thing, but your shoes have a huge impact on your walking biomechanics. The wrong shoes can literally change the way your feet, ankles, knees, and hips move when you walk. And if those structures aren't moving correctly, it leads to pain and injury. The most common shoe mistake I see is people wearing shoes that are too cushioned or too rigid. There's this trend right now of ultra-cushioned shoes, and while some cushioning is good, excessive cushioning can actually be problematic. When there's too much cushioning between your foot and the ground, your foot becomes less stable. Your foot muscles, your ankle muscles, and your leg muscles don't have to work as hard to keep you stable. Over time, these muscles become weaker. Additionally, excessive cushioning can make you feel less connected to the ground, which actually can make you less stable and more prone to falls. On the other hand, shoes that are too rigid and don't allow your foot to move naturally are also problematic. Your feet are designed to move in specific ways when you walk. Your feet are supposed to have some flexibility. If your shoes are too rigid, they prevent that natural foot motion, and this can lead to foot pain, plantar fasciitis, and other foot problems. The other shoe mistake is wearing shoes that are worn out. Once shoes get old and the cushioning breaks down, they stop providing the support that your feet need. If you're wearing the same pair of shoes for years and years without replacing them, the support is likely degraded significantly. The fix is to wear shoes that are specifically designed for walking. Good walking shoes have moderate cushioning, not excessive. They have good arch support. They have a flexible sole that allows your foot to move naturally, and they're in good condition. I typically recommend replacing walking shoes every 300 to 500 miles of walking. If you walk regularly, that might mean replacing your shoes every year or so. Additionally, it's a good idea to get your gait analyzed at a specialty running or walking store. Many of these stores have the technology to video your gait and can recommend shoes that are specifically suited for your walking pattern. Now that I've explained the 7 major mistakes, I want to talk about how to put this all together and start walking in a way that supports your health rather than destroying it. Because knowing what the mistakes are is good, but actually implementing the corrections is where the real change happens. The first thing I want you to do is to become aware of your current walking pattern. I recommend actually recording yourself walking or having someone else record you. When you can see yourself walking from a side view and from behind, you'll be able to spot a lot of these mistakes that you might not be aware of otherwise. You can do this on your phone. Just have someone walk behind you or beside you at a distance and film you walking naturally. Watch the recording and see if you notice any of the mistakes we've talked about. Are you shuffling? Is your posture slouched? Are you landing hard on your heels? Are your arms not swinging? These are the things to look for. The second thing is to start implementing the corrections one at a time. Don't try to fix everything at once. That's overwhelming and it's not going to work. Pick the one mistake that you think is the biggest problem for you. Maybe it's your posture. Or maybe it's your stride length, or maybe it's your foot strike. Whatever it is, focus on that one thing for a week or two until it becomes automatic. Then, add the next correction. This gradual approach makes the changes sustainable and keeps you from feeling overwhelmed. The third thing is to be patient with yourself. Changing movement patterns takes time. Your body has been walking the same way for years or decades, and it takes time to rewire those neural pathways and create new movement patterns. It might feel awkward or weird when you first start making these changes. That's completely normal. It doesn't mean you're doing it wrong. It just means your body is learning something new. Give it time. After a few weeks of practice, the new movement patterns will start to feel natural and automatic. The fourth thing is to pay attention to pain. If something hurts when you're walking, that's a sign that something is wrong. It might be that the correction you're trying to make is causing temporary discomfort as your body adapts, but it shouldn't be sharp or severe pain. If you experience sharp or severe pain, stop and reassess. Maybe you're overdoing it, or maybe you need additional help from a physical therapist or another healthcare provider. But mild discomfort as your body adapts to new movement patterns is normal and expected. The fifth thing is to complement your walking with other exercises. Walking is great, and I'm not saying you should stop walking, but walking alone isn't enough to maintain optimal health, especially as you get older. I recommend incorporating some strength training to maintain muscle mass, some flexibility and mobility work to maintain your range of motion, and some balance training to reduce fall risk. Even just 20 or 30 minutes a few times a week of these other types of exercise can make a huge difference in your overall health and function. Let me talk about what proper walking looks like when you put all of these corrections together. Imagine you're walking down the street. You're walking with proud posture, your head is up, your eyes are looking forward and slightly down, your chest is open, your shoulders are relaxed, your spine is relatively straight, your core is gently engaged. You're not sucking in your stomach, but there's a mild contraction that's stabilizing your spine. You're taking purposeful strides that are a natural length for your body. Your foot is landing gently on your heel with your knee bent slightly. As your foot hits the ground, your weight rolls from the outside of your foot to the inside, and then you push off from your toes. Your arms are swinging naturally from your shoulders, slightly bent at the elbows. Your movement is smooth and flowing. Your pace is steady and sustainable. Your breathing is rhythmic and controlled. This is what good walking looks like. This is walking that's supporting your health rather than destroying it. Now, I want to talk about what happens when you start walking correctly. The benefits are pretty remarkable, actually. In the short term, over the course of a few weeks, you'll probably notice that you have less pain. If you've been dealing with knee pain, hip pain, or lower back pain related to your walking mechanics, correcting your walking form can significantly reduce that pain. You might also notice that you have more energy. Walking with proper form is more efficient, so your muscles don't have to work as hard, and you don't get as fatigued. You might also notice that your breathing is easier. With proper posture and proper core engagement, your lungs have more room to expand, and you can breathe more deeply. Over the course of weeks and months, you'll notice more significant improvements. Your posture will improve not just when you're walking, but in your everyday life as well. You'll have better balance and stability. Your leg muscles will get stronger. Your core will get stronger. Your cardiovascular fitness will improve. Many people also notice that their mood improves with regular walking. Walking is great for mental health, and when you're walking properly and feeling strong and capable, the mental health benefits are even greater. Over the course of months and years, the benefits are transformative. You'll maintain your mobility and independence as you age. You'll have fewer falls and fewer fall-related injuries. You'll have better overall health. You'll likely have fewer trips to the doctor. You'll have more energy and stamina for the activities you enjoy. And you'll simply feel better on a day-to-day basis. The other thing I want to mention is that correcting your walking mechanics often has a positive ripple effect on your overall movement and posture. When you start walking with better posture and better mechanics, you'll find yourself carrying that improved posture into other activities as well. You'll sit with better posture. You'll stand with better posture. You'll climb stairs with better mechanics. You'll pick things up off the ground with better mechanics. It's like the improvement in walking creates a whole body improvement in how you move. Now, I want to address some common concerns that people have when they're thinking about implementing these corrections. The first concern is that it's going to be hard or that it requires a lot of effort. And yes, it does require some effort and some conscious attention at first. But the good news is that once you've practiced these corrections for a few weeks, they become automatic. You don't have to think about them anymore. Your body just does them. It's like when you learn to drive a car. At first, it required a lot of conscious attention, thinking about the clutch and the steering and the pedals, but after a while, it becomes automatic, and you don't have to think about any of it. The same thing happens with walking mechanics. At first, it's conscious and effortful, but after a few weeks of practice, it becomes automatic. The second concern is that these corrections might not apply to them specifically because they have a specific condition or limitation. And while that's a possibility, I would say that the vast majority of people over 50, even people with arthritis or other conditions, can benefit from at least some of these corrections. If you have a specific condition or limitation, you might need to modify the advice slightly, but the general principles still apply. And if you're unsure, consult with a physical therapist or another healthcare provider who can assess your specific situation and give you guidance tailored to your individual needs. The third concern is that these corrections are going to make their walking less enjoyable or more uncomfortable. And that's understandable, but it's usually not the case. In fact, most people find that walking with proper form is more enjoyable. It feels smoother and easier. It doesn't hurt as much. They have more energy. They feel stronger and more capable. So while the transition period might feel a bit awkward, once you've adapted, most people actually prefer the corrected walking pattern. Let me talk a little bit about the specific benefits for different body parts. Your knees will thank you. Proper walking mechanics reduce stress on the knees and reduce your risk of knee arthritis and knee pain. I can't tell you how many people come into my clinic with knee pain that's primarily due to poor walking mechanics. When we correct their walking mechanics, the pain goes away without any medications or injections needed. Your hips will thank you. Walking with proper form improves hip mobility and stability and reduces your risk of hip pain and hip problems. Your lower back will thank you. Proper posture, core engagement, and foot strike all reduce stress on the lower back and help prevent lower back pain. Your feet will thank you. Walking with proper foot mechanics reduces your risk of plantar fasciitis, bunions, and other foot problems. Your ankles will thank you. Proper walking mechanics improve ankle stability and reduce your risk of ankle sprains and ankle pain. Your whole body will thank you because walking is one of the most important activities you're doing. If you're doing it wrong, it affects your entire body. If you're doing it right, it supports your entire body. I also want to mention that there's a difference between casual walking and intentional walking. Casual walking is walking just to get from point A to point B. You're not paying any attention to your mechanics or your form. Intentional walking is when you're consciously paying attention to your form and mechanics, and you're trying to walk in a way that supports your health. Now, casual walking is fine. You don't have to intentionally walk every single time you go for a walk. But I would recommend doing intentional walking at least some of the time, especially when you're first implementing these corrections. Once your improved mechanics become automatic, you can just walk naturally and not worry about it. But during the learning phase, intentional walking is important. I want to give you a practical program that you can implement starting today. Here's what I recommend. Start by recording yourself walking so you can see what your current pattern looks like. Take a front view, a side view, and a back view if possible. Watch the recording and see if you notice any of the 7 mistakes we talked about. Then, pick the one mistake that you think is the biggest issue for you. Focus on correcting that one thing for 1 to 2 weeks. Once that correction feels automatic, add the next correction. Continue this process until you've implemented all of the corrections that apply to you. Additionally, I recommend doing some flexibility and mobility work. Tight muscles can restrict your movement and make it harder to walk with proper mechanics. Spend 10 to 15 minutes a few times a week doing stretching or mobility work focused on your hips, your calves, your hamstrings, and your lower back. These are the areas that tend to get tight and restricted. I also recommend doing some light strength training focusing on your core, your glutes, your hip muscles, and your leg muscles. These are the muscles that need to be strong to support proper walking mechanics. Just 2 or 3 times a week, spend 15 to 20 minutes doing bodyweight exercises like planks, glute bridges, squats, and lunges. These exercises will significantly improve your ability to walk with proper form. And finally, make sure you're wearing shoes that are appropriate for walking. Get shoes specifically designed for walking, not running shoes or fashion shoes. Make sure they have good arch support and moderate cushioning, and replace them when they start to wear out. If you can implement these changes, I'm telling you, your body is going to feel significantly better. Your pain is going to decrease. Your energy is going to increase. Your mobility is going to improve. Your independence is going to improve. And your overall health and longevity are going to improve. The bottom line is this: walking is one of the best things you can do for your health, but only if you're doing it right. Millions of people over 50 are walking wrong, and they're paying the price in terms of pain, mobility loss, and joint problems. But the good news is that you can change this. You can learn to walk in a way that supports your health rather than destroys it. It doesn't require any fancy equipment or expensive gym membership. It just requires some awareness and some practice. And the payoff is huge. Better health, better function, better mobility, better independence. That's what's at stake here. That's why this matters so much. So here's what I want you to do right now. I want you to think about your own walking. Do you recognize any of these 7 mistakes in your own pattern? Do you shuffle? Do you lean forward? Do you not swing your arms? Do you take short steps? Do you land hard on your heels? Whatever it is, I want you to pick one thing that you're going to work on, and I want you to start working on it this week. Film yourself walking, see what you look like, identify the corrections you need to make, and then start implementing them. One step at a time, literally, one correction at a time. And if you find this video helpful, I want you to share it with people you care about, because I'm telling you, most people over 50 are making these walking mistakes, and most people have no idea. If you can help someone avoid pain and maintain their mobility and independence, that's a gift. So share this video. And if you haven't already subscribed to the USA Senior Care channel, I'd love for you to do so. We post videos every week about health, fitness, nutrition, and other topics that are important for people who are 50 and older. We're focused on helping you maintain your health, prevent disease, and live a long, independent life. So subscribe now, and I'll see you in the next video. Thank you so much for watching. I really appreciate your time and your attention. If you have any questions about walking mechanics or any of these corrections, please leave a comment below. I read and respond to as many comments as I can, and I love hearing from my viewers. What has been your experience with walking? Have you dealt with pain that you thought might be related to your walking mechanics? Let me know in the comments. And if you've already tried implementing some of these corrections, I'd love to hear how it's going for you. Again, thanks for watching, and I'll talk to you soon.